mornings.
Morning, Doctor. How are you?
Not bad, thank you.
You look lovely today.
Thank you very much. It is
That's
Maria.
a lovely coat. Where did you get that from? I'm looking for something like that. I mean, I do like this one, but...
I'm sorry to bother you. So you were mentioning about your general medical history.
Yeah.
Do you suffer of any urine problems at all that we should know about?
Oh, not this one.
Not this one. So any heart problems?
Oh no,
Any
my heart's very, I'm very healthy. I'm very lucky, Doctor.
Just a quick question though.
Yes.
Any lung problems such as asthma, for example, which makes you cough?
No,
Good.
nothing like that at
Do
all.
you have any nerve problems at all? Anything that affects your peripheries, your feelings, or diabetes? Or
No,
anything
no
of the sort?
diabetes.
You
No.
know about them if you
Yes, a couple of my friends do have diabetes
Fine,
though, and
but
it's
you don't.
very. They can't eat all of the sweet
Oh, yeah,
things, and I
unfortunately.
love red velvet cake. Actually, I've made some
Can I
red
just
velvet cupcakes
quickly-
recently.
Can I just-
Do you like red velvet cupcakes?
do,
I've
I
just
do.
discovered them
Let's
recently.
talk
I've got a
about-
fantastic recipe.
Good.
Now,
So
Doctor,
just-
they're really lovely earrings. I've
Thank
been
you.
looking for some earrings like that. Actually,
Let me tell you what
they
we'll
would match
do.
my pearls.
They
I
would.
think.
Let's get back to the earrings soon after we finish this,
Oh,
so that we make
okay.
sure we're not missing anything important.
Sure, I understand.
So you're having a procedure called a vaginal hysterectomy.
Yes, I remember that. That's what he said.
Repair.
Yes.
So-
He also said something about
A repair.
Yes,
Exactly.
yes.
Now, let me explain to you what's happening first of all. Do you understand what a vaginal hysterectomy is?
Well, he did give me a bit of an explanation.
Okay,
but
so let's say this is your pelvic
it's all
floor.
very complicated, isn't it?
It
There
is.
are a lot of
Let's
things that...
simplifying it by
Right.
drawing it. Maybe it would
Oh,
help you.
okay.
So this is your womb, okay, initially inside your pelvis properly, as it should
Right.
be beforehand. Now, as you grow older, as you have children and you deliver, the muscles become a bit laxer, the tissues become a bit softer, and the womb starts moving downwards, and that's called a prolapse.
With my last
Mm-hmm.
child, oh bless him, he was quite a terror though.
Okay.
It was a very difficult labour, I have to
So
say.
how many children have you had in the
Oh,
womb?
I've got 4.
4 children.
They've all grown up now and they're just lovely.
Delivered how? Was it a vaginal delivery first of all in all of them? So it was,
Yes,
including
it's
your
all
last
normal.
one.
I've been very lucky there too. But with the last one, something happened, and I had to get some
Stitches.
Yes. It really quite hurt.
It is unpleasant.
Yes.
Apart from the stitches, though, did they mention at the time that you had any bowel tears or any tears which involved your bowels and you needed long-term treatment for it? Now, because
Terrible,
it pulls
isn't it?
down, what happens is you can actually get some pulling from in front, and you get sort of a bladder prolapse called a cystocele. You can get bowel pulling down from behind, and that's called a bowel prolapse. So what we plan on doing is removing the womb that has come down, and that's the vaginal hysterectomy part.
Right.
And then stitching the front part and the back part up to repair it. So we're actually pushing and stitching everything up again
Right.
to maintain everything tight and well. From your point of view,
Have you done a lot of these
We
surgeries
have, yes.
before you have?
so what you're going to expect
Right.
effectively is coming into hospital, getting a bed in the ward, having the
Will
procedure
it be a
done.
nice bed?
It will.
Should I
They're
bring
nice
my own
nurses.
pillow perhaps? Because
You,
sometimes
you could, but I think
Right.
that's a discussion you will have with the nurses later on.
Right, okay.
It's more
Which nurse will I
important-
need to see?
It's the ward nurses, but it's
Okay.
more important at this point that we'll clear out the medical part of things.
Right.
So if I can sort of explain to you what will happen when you wake up.
Sure.
When you wake up, you're going to have a little catheter inside your bladder, and it's going to be there to actually help the bladder drain out of urine. So you don't need to go to the toilet to wee for the first day or so until you're actually up and about and moving properly.
Right.
Okay?
Is that painful then?
It's not painful, might be a little uncomfortable, but the moment you get up and going, we will take it out and you can start weeing properly
Right.
again.
Okay.
To prevent bleeding from the vagina, you will also probably have what's called a vaginal pack, which is like effectively a tampon inside the vagina, and that will stay there again for a day or so to
Right.
prevent you bleeding and bruising. That again will come out within a day or so, depending
Right.
on the outcome of it.
Right.
You're usually in hospital for a couple of days' time. Again, depends on how quickly you recover, but we'll send you home eating and drinking normally and walking and talking normally as well. So you'll be well before you
that's
go
lovely.
home. Now, as regards bowel, do you suffer of any bowel problems? Any leaking of your bowels?
God, no.
Good. And do you suffer
That would
of
be
any...
terrible,
Very
wouldn't it?
bad.
Yes.
As regards constipation goes, are you chronically constipated?
Oh, I never... No.
Fine, you say
nothing
you're
like-
normal with that.
Yes,
And there's no
yes.
bleeding from behind?
Oh, no,
And no
no.
unexplained blood loss at all? from
No,
behind?
no,
Good.
no.
Any problems with your urine at all? Do you have any wee problems?
No.
So you don't leak at all?
Oh, no,
Good.
nothing like that.
And there's nothing that wets
I do
your
know
panties?
that some of the ladies, though
They
I
do.
have tea with, they've talked about, it's very embarrassing.
But you don't have any coughing, leaking or anything?
Oh,
good.
no.
And when you need to go to the bathroom, do you have any problems with that? Do you actually manage
Oh.
to go, or do you need to run to the
Oh,
bathroom?
no,
to
no,
go?
no, no.
Good, so
No,
that's fine
no.
as well. And no wee with blood either that you know of?
No, nothing like that at all, Doctor,
We
thankfully.
know you've got the prolapse. When you go to the toilet, do you ever have to push the prolapse back in to open your bowels or your urine at all?
Oh,
No.
God, no,
Good.
that sounds
Good, good.
awful, but nothing
yes,
like
some women
that.
suffer from that, but it's good that
Oh.
you don't, so I'm glad about that.
Oh, I think the problem that I have is bad
this.
enough, but that would be
Yeah.
terrible.
One last thing, it's a personal question, but I think it's relevant for this sort of operation. Are you sexually active at all?
Oh, that is a personal
Yes,
question,
it is.
isn't it, Doctor?
There's a reason behind it, and I'll explain why.
Right, well, yes, and in fact, and it's very embarrassing, but that's how my husband.
yeah,
Yes, he
noticed.
found it.
All right.
It was very uncomfortable, and it was awful. But he's so lovely. He was
Good.
so supportive, and he was very, very concerned, and he wants to make sure that
I'm sure
I
he
get
is.
better, and
Yeah.
but I want to make sure that it will go away after this
The
operation,
reason
won't
why
it?
It will get better.
Yes.
The reason why I've asked about that is because soon we'll start talking about the risks of the operation.
Right.
And when you're sexually active, obviously having a vaginal operation will make you uncomfortable and sore from the bottom end.
Right.
It can also give you painful intercourse, especially near the operation.
Right. Well, I
So
don't
that's
think I'll be
something-
anything like that soon after
Soon
the
after
operation.
but
Yes.
it's something that we
It's
need
not
to
best. It
talk
would be.
about. It's
Right.
better if you're aware of it, so
Yes,
at least we can know
sure.
what's going on. So what we're going to talk about now is the risks of the procedure.
Right.
There are risks which we can actually know about and therefore hopefully deal with and prevent. Okay?
Right.
In this sort of procedure, there's the risk of an infection occurring, but that's usually dealt with antibiotics, so we usually cover it.
Right.
You are usually in pain, so we can give you good painkillers,
Right.
both for the ward and to go home on.
Yes.
There's the risk of blood
Will I be
clots.
in lots of pain then,
Well, you will
Doctor?
be in discomfort, but we
Right.
tailor the painkillers.
How long does the pain last for then
It
after?
will last severely, probably for a day or so, but
Right.
eventually it will settle down and we can give you medicines to take home with
I
you.
see. That's good.
As regards as inpatient
Will they be
stay,
painkillers that make you tired and sleepy? I've had some.
we will try and reduce the dose to avoid
Right.
that happening. But the
Okay.
most important thing we need to avoid is you getting blood clots.
Right.
Now, blood clots can happen in the legs, called thrombosis, or in the lungs,
Yes.
called embolisms, and we give you a little injection after a day of the procedure
Right.
to help the blood thin out and prevent blood clots.
Right.
We'll also give you stockings to wear, which are like tight little tights to
Oh,
wear.
wow.
Again, those will prevent you from getting a blood
What
clot.
colour would those be?
Unfortunately, usually they're ugly white.
Oh dear.
And then we will also get you out of bed walking quickly to get you
Right.
going on and about.
Right.
Now, in this procedure, there's a risk of bleeding. Usually, during this sort of procedure, we do not expect massive amounts of blood loss, but inevitably there is an amount of blood loss. The
Well,
question,
Doctor, that's something that I'd be very concerned about with the bleeding. Yes.
concerned about bleeding, but the question is, one of the options which I will have to consent you for really is the possibility of you receiving a blood transfusion.
No,
Is that something you would or would not consider?
I would not be considering that, and I cannot accept any.
Fine. Is that because of religious
That's
view?
correct,
And
yes.
what religion do you pertain to? if
Right,
I ask?
I am Jehovah's Witness,
Okay.
so I will not be accepting any
All right.
blood products
So
whatsoever.
it's good to know that, because first of all we'll try and
But Doctor,
optimise.
you're the consultant and yourself, you're very clever, and the doctor,
Well,
he seemed very
surgically-
qualified, so I would imagine that would not be happening. Is that
Well,
right?
surgically we'll take the utmost care to prevent heavy blood loss unnecessarily. We'll also make sure to minimise that and to prepare your blood optimization before that, and I'll explain to you what that means. What we'll need to do is we'll take a blood test today to check your blood levels and your iron levels.
Right.
And if you need to, we will give you some blood iron. We will just give you iron therapy, iron tablets to
Right.
take home.
Okay.
We'll sort that out. We'll also consider giving
That's
you...
not blood products, though,
That's
is
not
it?
blood
No,
products,
right.
it's just iron tablets.
Right, okay.
We'll give you an injection, if needs be, in conjunction with the blood specialist called erythropoietin to maximise your blood only if you needed it. And in the procedure, we will be using a blood cell saver machine, if you accept that, which means we actually collect the blood that you lose and give it back to you. Is that something that you would consider, your own blood being collected and given back?
Well, that sounds Very interesting, but I'm not sure.
Okay.
I mean, that's definitely my own
It is
blood.
your own blood, yes.
Right. Well, I'll need to have a think about that.
The main important thing we need to know about really is if you are losing such an amount of blood that no matter what we do medically or surgically, there is a risk that you're going to die if you don't get a blood transfusion.
I will not be accepting
You will not accept that either.
No, I will not be accepting.
Fine, so we'll
But
go
I'm
through the...
very confident that you're a consultant.
We will
and
try
that
and
you will-
minimise it as well.
Yes,
So
please.
quickly moving on to the last few risks which you need to be aware of.
Yes.
When you're operating through the vagina, you're obviously operating with knives, with sharp instruments. So there's a risk, it is uncommon as a risk, but there's a risk of about 2 in 1,000 bladder damage and a risk of about 5 in 1,000 bowel damage.
Right.
Very uncommon to happen. If it does happen, we will call in the relevant specialists.
So that's not something that you could fix then, Doctor?
If it's a
Is that
minor
what
thing, we
you're
could
saying?
fix it, but I think for safety's purposes, if we
Right.
need a second opinion, we will call them in.
Has
If-
that happened before with you?
It is uncommon, as we've said.
But has that happened before with
We
you or the
haven't
doctor?
actually needed to do that in some time, but
Right.
medicine is medicine, you never can say never.
Right.
What you need to be aware of is that if you're bleeding very, very heavily from the vaginal route, we might decide to open up the tummy in the form of a tummy cut to get in fast to stop the bleeding. But that is in an
Sounds
emergency
very, very
situation.
complicated and terrible, Doctor.
It
and
is
I
not a nice
really,
situation.
Really hope that that won't be happening.
It hopefully won't.
Yes.
But because we know blood is so important with you and we know we cannot lose it, if you are bleeding heavily, it might be something we would do.
Right.
As in all operations, there is a risk of the anesthetic, which means the actual medicines that put you to sleep, but you will be seeing our consultant anaesthetist who will go through the details of that with you. Not in this room at the moment.
So that's another doctor that will be
Yes,
involved.
but she's a very nice lady.
Oh,
knows- yes.
Oh, lovely.
She knows
What's her
stuff
name?
very well. Well, the name depends on the person coming in. We've got 2 ladies working with us.
Oh, are they both nice?
They're
then?
both very
Oh,
nice ladies. But I
good.
think the best thing will be we'll wait until we get there and I'll introduce you. And
Oh,
we'll have
that
a
would
word
be
with that.
lovely. Thank
Okay?
you, Doctor. That would be great.
The last thing is the risk of, well, it's the most rare risk, but a severe risk, which is a risk of loss of life during an operation.
Right.
Now, we've spoken about various other risks. It is very rare, so it's quoted around 37 people per 100,000.
Wow.
So it's not at all something that happens on a day-to-day basis. But in
It's very
signing-
scary though, isn't
It is
it?
very scary, but in signing the consent, at least you know you're informed about the risks of that.
The
happening.
consultant said this was a very simple sort of operation, although some of the things you've said
Well,
are a bit complicated. But I
operation,
mean,
when you do
I
it
can't
many
imagine
times-
that people would die from this. That's terrible, though, isn't it?
We can all die from any situation, not necessarily an operation.
Yes.
But you need to be aware of the risks.
It's not something you'd like to think about, though, is it?
But these are risks
It's
that we
not
need to be
think
aware
about
of.
those sorts of things.
We don't
isn't
like
it?
to think about it, but my job here is to inform you of the risks and then make you informed decision as to whether or not you'd like to go ahead with it or cancel your operation if you decide otherwise.
It's a lot to think about there, isn't
It is.
it?
But I think what we should do is we'll go through the paperwork, we'll fill all the forms and make sure that you're fully aware of what we're saying. I'll give you a copy of the consent form to take home with you and you can basically have a think about it.
Right.
You can decide to change your mind just before the operation, so it doesn't
Right.
really matter. But I think having you sign it today, having you take it home with you, having a think about it, and then coming back in on the day of the operation
Yes.
gives you some time to consider all your options.
Yes, I mean, you've given me a lot of information today, Doctor, so I think I would like to just take it away and have a think about it and maybe sign later on then too. That's okay then, isn't
I think
it?
what we should do is we can sign the initial consent today because it ensures us that you're aware of what's happening.
Right.
On the day of the operation, we will see the same consent form and perform what's called a confirmation of consent, which means we'll show you the exact same paper that you've taken home with you and we re-sign it together on the day of the procedure.